So welcome back, dear students. Let's move on to types of infections part 2. And based upon the source of infection, you can classify infection as exogenous or endogenous. Now, from where do you get the infection? If you get a pathogen from an external environment, that is other than from your body, if you get an infection from a pathogen which is from your external environment, then it is referred to as exogenous infection. Now, these pathogens can come either from any contaminated device or a healthcare worker or a surface or any other vector, then that is also referred to as an exogenous infection. And sometimes patients with open incisions, indwelling devices, and compromised immune systems, they are the people who usually get exogenous infections. That is, from an external source, if you get an infection, that is referred to as an exogenous infection. Now, on the other hand, sometimes you can see that infections can occur by normal bacterial flora which occurs within our body itself. Now, for example, you can find that the normal bacterial flora of your own body can enter into the otherwise sterile area. Now, for example, brain and muscle and all that, these are areas where normally bacteria do not survive. So, whereas you have your skin as well as your mucous tract, respiratory tract, gut and all that, they are all host, or they are the home for a large number of bacteria. So if these bacteria, if they happen to enter the brain or into the muscle uh, and cause an infection over there, that is a case of endogenous infection. So residential bacterial E. coli of the GI, if it is entering into the urinary tract, you know what is a GI? Gastrointestinal tract. So if the gastrointestinal tract residing E. coli happens into enter into the urinary tract and cause an infection, that is a endogenous infection. So I guess you are clear with that. Another case which we have to describe is a focal infection. It mainly refers to a condition where, due to the infection or sepsis at localized sites such as tonsils or appendicitis, or sometimes even in your tooth, if you get generalized effects, then it is referred to as a focal infection. That is, usually uh, in the case of focal infection, you at certain specialized areas you'll be having infection, but you will be having a generalized effect because of that. That is now it is a usually it's a local, as a term focal itself, focal and local, the term itself, it is a localized infection, and often it has been found to be asymptomatic. And what happens is, as a result of that, the disease is, though the causative agent is being present at one particular region, the symptoms of it, either it will be remain asymptomatic, or the disease uh, is being caused at one particular region, or it might be what does it means, though the causative agent is located at one particular region, the total disease is being found to be somewhere else. It is a distant injury. That is a main key principle of the focal infection. Now I'll give you one example. Sometimes you might have an infection in your teeth, but as a result of that, you might get a generalized what uh, uh, a weakness. Sometimes within your, you might get headache or a body pain or something like that. So though the causative agent is being located at a particular region, you will get a generalized ill effect. That is a case of a focal infection. And focal infections are frequently, they are being found to be fairly infrequent. That is, they do not commonly occur, and they are limited to fairly uncommon diseases. Sometimes you might get some types of focal infection: cellulitis, conjunctivitis, endocarditis, lymphadenitis, osteomyelitis. These are all examples of the focal infections. Now let's talk about the teratogenic infections. What is a teratogenic infection? A teratogenic infection is an infection which is being caused by an infectious agent, and if it causes abnormality or a fetal damage, during the pregnancy, then it is referred to as a teratogenic infection. Now, a teratogen is any agent which will cause abnormality following the fetal exposure during pregnancy. And usually the exposure to teratogens, it could be chemical agents also, teratogens. And if it causes a birth defect, it is considered to be as a teratogen. Now, what is a teratogenic infection? If some infections lead to what? Embryo fetal lesions or embryo damage during its growth, then it is referred to as a teratogenic infection. As we know, teratogenic infections or the infections are mainly being caused by bacteria, virus, fungus and all that. And the most commonly commonly found teratogenic infections can be classed as a TORCH group of infections, such as toxoplasmosis, O refers to others, R is rubello, cytomegalovirus for C, and H for herpes. So if during the pregnancy, if you get infected by either of these infectious agents, it might lead to the embryo damage, and the damages which or the infections that lead to embryo damage or the fetal damage during pregnancy are referred to as a teratogenic infections. Now, what is a latent infection? A latent infection is an infection that is hidden, inactive, or dormant. Now, sometimes you can see that in addition to the active infections where a virus bacterium is actively replicating and potentially causing various symptoms, latent infections are mainly considered to be as static in nature. That is, they will be remain to be silent or they may be hide from the immune system, and for some period of time they might not cause any much of any much symptoms, or they will be within your body or and they will not be causing any symptoms. They will be inactive or dormant. Then after some time, when the environment is favorable, the infection or the infectious agent might cause the symptoms. Such cases do often occur in the case of viruses, and herpes is a case of herpes infection is an example of a latent infection. Now we have the laboratory acquired infections. In the laboratory acquired infections, it's quite common in the microbiological laboratories. It is also called as an occupational illness or a laboratory associated infection. And you can see that in clinical laboratories as well as in animal facilities, in R&D or in product installations, you can find this lab associated or the laboratory associated infections. And it mainly occurs when if a worker gets infectious disease by a microorganism which has been present in the laboratory, and LIAs are of public health concern, as an infected worker may present a risk of transmission to his colleagues, relatives, family members and other citizens. And if you go to look into the laboratory acquired infections, you can see that there are different classes of bacteria which can cause to infections. It could be now Bacillus species, Coxiella burnetii, hepatitis B, C, D viruses, Salmonella typhi, Francisella, and all that. Like that, different types of bacteria which normally occur in the laboratory can cause infections. So you just know some terms or some infections which could be caused from the laboratory. Now let's move on to the congenital infections. The infections which affect the unborn fetus or the newborn infant, it is referred to as a congenital infections, and they are usually caused by viruses that may be picked up by the baby at any time during the pregnancy up through the time of delivery. So if the unborn fetus gets an infection, as I told you earlier in the case of toxoplasmosis, cytomegaloviruses, etc., if the unborn baby or the fetus gets a particular infection, that is referred to as a congenital infection. Now, the types of infection can be also being classified further on. Now, based upon the severity and the duration, you can either have acute infections or chronic infections. Acute infections are short, but they are being found to be very severe. Whereas chronic infections, they persist over a long time for many weeks, but the severity will be found to be very less. And based upon the area of spread, you can also again classify infection. If it is occurring throughout your body or if it is spreading throughout the body, it is called a systemic infection. Or if it is restricted to a particular region or limited region or one or two anatomical areas, it is referred to as a localized infection. So, acute infection and chronic infection. Uh, uh, Acute infection is a sudden onset and a severe symptoms has occurred, and in chronic infection you get a delayed or a slow progression in the case of chronic infections. But now you can have a look into this. Now, for example, a virus is appearing, entering, and sometimes what happens suddenly itself, if it gets a sudden infection or a sudden symptoms, severe symptoms comes, it might become an acute infection. Or sometimes it might, what happens, it would remain what you will not get symptoms very soon, and at a small stage only you will get, like it would be very much severe progressively. If you get infection, that comes under the case of chronic infection. And localized as well as systemic infection, depending upon the extent to which it has been extended. That is, sometimes systemic is something which is present throughout your body, or localized is at a specific location of your particular body. Now, you can also classify the pathogens which causes different types of infection. If it is caused, sometimes it might be caused as a primary pathogen, or sometimes it might be caused as an opportunistic pathogen. You know what is a primary infection and what is opportunistic infection. So, based upon what type of infection it causes, it might be called as a primary pathogen or an opportunistic pathogen. And there are some terms also which I would like to talk about. The bacteremia, when a viable bacteria has been present in your blood, you call it as bacteremia. And if virus has been present in your bloodstream, you call it as viremia. And septicemia is a case, it's a disease associated with the presence of pathogen or the bacterial toxins in the case of blood. So I guess you got across what are the different types of infection, some of the important terms, because unless and until we know if what are these terms, you won't be able to. Sometimes they will just say localized infection of so and so place or systemic infection. So you should be quite familiar with all these terms, the types of infections as well as the terms in medical microbiology. Hope so it is clear to you. With this we come to an end, and thank you for now.